Welcome, everyone, and thank you for joining today's virtual event, Medicaid and Health Equity 100 Years After the Tulsa Race Massacre. My name is Matt Glanville, and I'm the Oklahoma Government Relations Director for the American Cancer Society Cancer Action Network, or ACS CAN, as you may have heard us called. I am honored to be a part of today's event, which is the third installment of our Medicaid Covers Us Health Equity Virtual Event Series, as we take a look back at what was a thriving community in Tulsa and how the racial violence of the 1921 Tulsa Race Massacre and ensuing systemic and structural racism are still being felt today. As many of you know, ACS CAN is the advocacy affiliate of the American Cancer Society, where it is our mission to pursue a world free of cancer through public policy interventions. We know that cancer impacts everyone, but it doesn't impact everyone equally. So we are working to ensure that everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. No one should be disadvantaged in their fight against cancer because of how much money they make, the color of their skin, their sexual orientation, their gender identity, their disability status, or where they live. In 2019, we launched a project called Medicaid Covers Us to share stories and resources about the importance of Medicaid, which, as you know, is a health insurance program for low-income families. This year, we continue that project with a focus on how Medicaid can play a role in addressing health disparities across the country. In today's event, we're focusing in on the Greenwood district in Tulsa. While the Tulsa Race Massacre happened here, the effects of racism in healthcare are rampant across the country, and many communities face similar disparities and inequities. Before we begin today's event, I want to take a moment to acknowledge the horrific events that took place on May 31st, 1921. There is simply no policy intervention that could ever be put into place to right the wrongs of what was done to the Black community in Tulsa. This was a robust community that had all the access to critical health care they needed right there in Greenwood. We saw a community go from being self-sufficient and thriving with access to critical healthcare needs to total destruction in a matter of hours. So we are not here to say today that we have all or even some of the answers to address the long-standing systemic and structural barriers that have plagued the Black Tulsa community for a century. And we are not here to say that disparities will disappear now that Medicaid has been expanded in Oklahoma. But we are here to discuss how Oklahoma's newly expanded Medicaid program can be utilized to help alleviate some of these long-standing disparities. Access to cancer treatment, supportive services, and preventive care. These are all priority issues for ACS CAN. And our goal is to reduce disparities and advance health equity in cancer care. Within the access to care space, much of ACS CAN's health equity work centers on protecting and expanding access to care for all communities, which is where access to Medicaid insurance coverage serves such a crucial role. Health insurance through Medicaid is a lifeline for cancer patients, survivors, and those at risk of the disease. And since Medicaid eligibility was expanded in Oklahoma on July 1st of this year, we've seen well over 100,000 people get access to the care they need. Many of these Oklahomans did not have access to health care before July 1st, and for some, this will save their lives. The large number of people who have enrolled just as soon as possible shows the enormous need and the value that people right here in Oklahoma see in having access to health insurance. Today, we are so honored to share a virtual tour with you led by Kristi Williams, and following that, you will hear from a panel of incredible partners and friends about health disparities that have existed in Tulsa as a result of the race massacre and the ways Medicaid expansion can help to play a role in reducing those long-standing disparities. But first, let us take a virtual tour with Kristi Williams, chair of the Greater Tulsa African American Affairs Commission, who also serves as the co-owner of the Real Black Wall Street Tour.
Tulsa has always been the tale of two cities. We just commemorated the 100th anniversary of the 1921 Tulsa Race Massacre. Greenwood was an economic mecca of Black entrepreneurship. 40 city blocks of commercial businesses, homes, a strong, viable community. It was the place to be. It was also called Black Wall Street, coined by Booker T. Washington himself. And it was also called Little Africa, speaking to the communal spirit that Greenwood had. Greenwood had an economy within an economy. It was doctors, it was hospitals, it was clinics, it was everything you could think about was right here within this community. On May 31st, 1921, 35 blocks of Greenwood was looted, burned to the ground, and bombed. There were hundreds of people who were murdered. The city has only documented 36, but there were more based on Red Cross and based on eyewitness accounts. So from May 31st to June 1st of 1921, what we known of Greenwood, Little Africa, was burned to the ground. So this is where the Dreamland Theater actually was. It's right here. Just imagine this highway not being here. And this Dreamland Theater was owned by Lula and John Williams. The Dreamland was a fancy theater. Not only did they hold movies in there, there were theater shows. They had community meetings in the Dreamland Theater. Everyone loved to come to the Dreamland Theater, even my great aunt Janie. On May 31st, 1921, the massacre happened here in Greenwood. So my great aunt Janie was 17 years old on a date. She was not supposed to be on this date. It was a secret date, as I'm sure most teenagers have done. But she was on this date here when the massacre happened. I just know that she said that they ran away going down some railroad tracks. And that's where a lot of people were going on these railroad tracks. And she escaped with her life. Just that traumatic experience and that trauma that you live every day just by coming through here and it being a reminder of what happened, and you don't want to hide it, you want to tell it. So there is a trauma in that. Remembering what took place here, it almost makes me emotional thinking about it because, you know, this is still a crime scene. I keep saying it's still a crime scene. It's sacred ground. This was where Dr. A.C. Jackson's home. It stood right here in this area. And on the night of the massacre, May 31st, 1921, a white mob came and ordered him to come out with his hands up. And Dr. A.C. Jackson came out with his hands up, and they shot him. And he not only serviced this community, but he was called from all over this country for his services. He also created tools for surgery that are used today, but that's not acknowledged and really talked about the way that it should be. And his neighbor, who was a white man, he said, "Do you guys know who you just shot? You shot that Dr. A.C. Jackson. He's our only surgeon." So they put him on the back of the truck. They took him to the convention hall, but in between there's another story that someone actually tried to get him help at a white hospital, but they would not accept him there. So it's so crazy that Dr. A.C. Jackson, who did these surgeries on white people as well as black people, but was not welcome into a white hospital to get help. So he bled to death right there on the back of a pickup truck, right in front of the convention hall. The convention hall, it was an internment camp. They separated the families. They took the women and the children, they put them at the fairgrounds, and then they kept the men at the convention hall. A lot of men went in, a lot of them came out in body bags. And so today you have concerts and going on in that same facility that was an internment camp for the Black residents of Greenwood.
Christy, we know that North Tulsa had a thriving and self-sustaining healthcare infrastructure prior to the race massacre. Here we are, we're standing in an empty field, which was once the home site of one of Oklahoma's great surgeons. Do you think that this is sort of illustrative of the way that racism can carry forward and impact healthcare for an entire generation of people that live in a community like this?
When I think about the health infrastructure that we had here that is no longer, but there's no solutions that ever comes from it. We are in what we call Deep Greenwood, and we're right here in front of the Church of Restoration, which actually used to be a clinic. It was built in 1946, and Janice Jones ran this clinic. She was the first Black registered nurse in Oklahoma, and she wanted to start her own clinic. It took her to 1946 to do it, but she did it. This was her dream, and now you see her dream gone. You know, there is just no easy access to health care. And it's really crazy because when you think about in those days how you had health clinics, hospitals, but today there is no urgent care here in North Tulsa.
I know when Medicaid expansion happens on July 1st, it's really going to help a lot of people have greater access to care.
Not only with just day-to-day access to care, but also with the kind of life-saving care that comes with cancer screenings, regular screenings in the form of breast and cervical cancer screenings, colorectal cancer screenings. What kind of impact is that going to have on this community?
That's going to have a huge impact, and especially for people like myself who have insurance. You know, we need to really utilize that, but for those people who don't, it is great to have those screenings right here in this community. So right now we're standing right at the dividing line. This separated the black side, the white side, literally. And so this is those tracks.
So what you're saying is, despite the fact that, you know, we have this bridge here, the railroad track was the dividing point. This is North Tulsa, this is downtown Tulsa.
Right. This is the wrong side of the tracks. Definitely.
This dividing point is also a dividing point really when you look at health disparities, about when we always talk about the difference in life expectancy between North Tulsa and Midtown / South Tulsa, but also your access to care.
Yes, you do. And again, there's no health clinics, urgent cares in North Tulsa on this side of the tracks. But you have to go on this side of the tracks to get urgent care.
Wow.
Or just emergency room, right? Doctor's offices, where there's not any of that, you know, really in North Tulsa.
When we talk about health disparities and health equity, we know that Medicaid expansion can open so many doors for so many people in Oklahoma. And just since the passage of expansion, we've seen people sign up. We've seen 100,000 Oklahomans sign up in a matter of days for Medicaid expansion.
Well, the Medicaid expansion definitely has helped, you know, the community get access to health care, but also people can't even get jobs here who live in this community, right? So we have to talk about those things. And better jobs, access to health insurance, health care, those things are definitely needed right here in this community.
Christy, we're at a site in North Tulsa, which is known as the Steps to Nowhere. Can you tell us why these steps are here?
These steps are here because urban renewal, what we call urban removal, got rid of a lot of these homes. And it's just a reminder of the lack of development, the lack of homes that exist in North Tulsa that are affordable for North Tulsans. If you want to see a doctor, you'll have to travel 15 to 20 minutes away from here, which is no problem if you have a car, but there's a lot of people who don't have cars, and some of those people have to take 1 or 2 buses to get health care. Here in Tulsa, Black people live 11 years shorter than our white brothers and sisters on the other side of the tracks. So it's blatant, the data is there to prove this. The kids have more cases of asthma. We have cancer in this community, high blood pressure, diabetes. We have too many health issues and no place to go for them. Medicaid expansion is a great step in the right direction. It's not going to solve every problem, but it's definitely going to set the stage. It's not that there is no will to want to do better. There's just no way right now. And Medicaid expansion creates a way to make it better for people in this community and other communities. It is a tale of two cities, and you have to be blind and crazy to not see it or to recognize it, and we have to stop being afraid to talk about it. If we're ever going to be that one Tulsa, we have to acknowledge and really just address these issues that we have together. This commemoration was just a reminder of what we need to do, showing us all the time we've wasted, and where do we go from here? That's what the commemoration was about. Where do we go from here?
Thanks, Kristi, for that impactful and moving tour through the Greenwood district in Tulsa to help center us in what was a thriving and self-sufficient neighborhood that had critical access to care within walking distance of their homes. Before I introduce our amazing panelists, I just want to reiterate that this discussion today is not to serve as an immediate or definitive fix for any wrongs that were done a century ago. This is simply to highlight the value of one program, the Medicaid program, and how the recent expansion of that program to cover more adults is one tool that is now available to aid in eliminating these long-standing disparities that exist, not only in Tulsa, but in the state as a whole. We want to recognize up front that Medicaid expansion is a small part of a much larger discussion that must continue in order to reduce disparities across the country. Now we'd like to share with you our panel discussion. We know that you will find it as robust as we did, and please don't worry, the panelists will be available for a live Q&A following the discussion. Before we share that discussion, I would like to introduce each of our panelists. We have Dr. Jabraan Pasha, who is a native of Tulsa. He's an internal medicine physician, the Associate Professor of Medicine and Assistant Dean of Student Affairs for the OU School of Community Medicine. He's an international speaker, frequently facilitating workshops on implicit bias and social determinants of health. We also have Councilwoman Vanessa Hall-Harper, who is a Tulsa native who represents District 1 and also chairs the Tulsa City Council. She's also the program manager for the Tulsa Health Department's Healthy Living Program and is an adjunct professor at the Tulsa Community College in the Political Science Department. Of course, we have ACS CAN's very own Lance Barbour, our senior state and local campaigns manager, and we also welcome in Kristi Williams. Thank you.
Well, thank you everybody for joining us today. I really appreciate your time and your willingness to talk through these issues with us. And I want to get us started with some questions for Lance. And in particular, Lance, can you tell us about why ACS CAN cares about Medicaid in Oklahoma and across the country?
Absolutely. Thanks, Matt. First, I would just like to start off by stating the obvious. Medicaid is health insurance. It helps to play a critical role in numerous communities throughout the country. It's a vital program for individuals, families, communities, health systems, as well as state and local economies. In many instances, Medicaid is a vital program for the prevention, detection, and treatment and survival of cancer. We know that 2.3 million Americans rely on Medicaid that have a history of cancer. Medicaid covers things like cancer screenings, diagnostic tests, treatments, surgeries, prescription medications, and follow-up care for cancer patients. We know, especially for cancer, that if cancer is discovered early, there's a better chance of survival, and it's a lower cost to treat the disease. Medicaid allows individuals and families to see a physician on a regular basis, so they don't need to wait for something to be wrong to the point to where they have to go to the emergency room because they can't get through their day-to-day lives. No one should have to choose between paying for healthcare and paying for rent or groceries. And we think that the role that Medicaid plays in the countless individuals that have gone through, as we have gone through a pandemic, is critical now more than ever. As we continue to eliminate systemic barriers that impacts a person's health and well-being.
Definitely. Now, we have obviously expanded Medicaid in Oklahoma, and that was a huge priority for our organization. Can you tell us a little bit about who now qualifies for Medicaid in Oklahoma?
So prior to Medicaid expansion in Oklahoma, those who qualify for the program was limited to children, pregnant women, individuals with breast and cervical cancer, some people with disabilities, seniors, and parents with children under the age of 18. Medicaid expansion would now extend coverage to those working non-elderly adults who fall in what we call the coverage gap. So those individuals that make too much money to qualify for their traditional Medicaid program, but not enough money to qualify for subsidies on the marketplace. And so we know that having health insurance through Medicaid will help Oklahomans continue to go to work, to stay healthy and care for their families, to pay the bills without worrying about themselves being one accident or diagnosis away from being $1,000 in debt with no means to pay for the care that they need.
Councilwoman, how do you see longstanding systemic and structural barriers contributing to the present day health disparities seen in Tulsa's Black community?
I think if we are going to be honest about the present day health disparities in Black communities in Tulsa or anywhere in this country, we must be honest about the history of this country. And that history is that the direct cause of health disparities throughout this country in Black communities. Whether you use the date of 1619 or you use the early 1400s, when Africans were forced to come to this country, these barriers started. The systemic and structural racism started, and they still exist today. Realizing, of course, that some 55 years ago, acts were finally passed that gave Black people rights in this country, doesn't take away from 400, 500, 600 years of oppression. And so the disparities that we see today are still persist because of the history of this country when it comes to Black people in this country and how Africans in America have had to exist. And so I do believe that that is the main reason why we still have these disparities. Because America has yet to address those in a real and tangible way. And so we have a lot of work to do. I think it's work that must be done. We have to acknowledge and realize that the disenfranchisement, the marginalization, and the undervaluing of Black lives is the reason why we still continue to experience these disparities. And so I think policy is the way in which to go about changing that, or at least moving us in a better direction. And of course, Medicaid expansion is a policy that I think will go a long way in getting us there, or at least on the right path.
Thank you, Councilwoman. Dr. Pasha, as a physician in the Tulsa area, can you talk about some of these historical disparities that we're talking about that exist, particularly in Tulsa's Black community?
Yeah, absolutely. We know from research that's been done within the last 10 to 12 years that there are some significant disparities that exist between Blacks living in certain communities compared to whites living in others. And specifically, we are well aware of a pretty wide life expectancy gap that exists between North Tulsa and South Tulsa. We have seen this gap close. It was somewhere around 14 years, several years ago. And just to put it in perspective, what it means is just by the chance of being born and raised in one community, chances are you're going to live to be about 80 years old. Right? Just by the chance of being born and raised in another community, you're expected to live to be about 60, 65 years old. That was the data that was startling, as you can imagine, to the medical community and now the Tulsa community in general. We have seen this gap close to around 8 to 10 years. It's a little bit difficult to say where we're at now. We know that one of the factors that has helped with that is access to clinics in North Tulsa. I would suspect that further access through health insurance, Medicaid expansion in this case, will play a role in hopeful role in helping to close that gap even further.
Thank you, Doctor. Councilwoman Hall-Harper, since the destruction of the Greenwood neighborhood in 1921, how do you think public policy has affected or even perhaps perpetuated disparities in this community in present day Tulsa?
I would definitely say that it has perpetuated disparities. We have a long way to go, and not just local policies, even federal policies, right? We have federal, state, and local. Urban removal, otherwise known as urban renewal, played a great role, a huge role in the disparities that still exist today, not only with healthcare, but any of the social determinants of health that we know exist and contribute to health, to life expectancy. And so when communities were first in 1921 destroyed again by politicians, by elected officials, by leaders, this was allowed to take place. And fast forward to the 70s, late 60s, early 70s, when what I call the second massacre of Greenwood took place, known as urban removal. And so, yes, the system of government, these structural and institutionalized practices, whether they are written in policies or whether they are just the practices the decision makers make at that critical time, North Tulsa, Greenwood has been divested. And that's clear. I would say that we are making some strides. We are at least monitoring, or at least trying to evaluate and keep track of equality indicators and health and the ability to generate wealth. And again, those things that we consider are determinants of health. But we certainly have a long way to go.
Dr. Pasha, one thing that we haven't touched on yet is really the financial impact to individuals and families. Can you talk a little bit about that financial impact that people face when they don't have access to healthcare and don't have insurance in the form of Medicaid?
Yeah, absolutely. And I can provide a personal story just to provide some context. A couple of years ago, I had to take a quick trip to the emergency department. I was in the emergency department for an hour. I'm insured, thankfully. The bill for that hospital visit was $5,000. So imagine the impact that would have on someone who is struggling, living paycheck to paycheck just to put food on the table and keep the lights on, right? It's clearly not something that they would be able to pay. And then there's definitely some issues down the road with interrupting their credit and a lot of, issues from that perspective. So what I always try to keep in mind is the priorities that individuals have. And if you don't have health insurance, it is really hard to prioritize your health. And I'd say almost every week, I have a patient who was unable to prioritize their health because of the potential financial impact that seeking healthcare would bring on themselves, their family, their children, right? It is an extreme barrier for care. And so just to know that there are going to be tens and tens of thousands, a couple 100,000 individuals who are now going to have healthcare coverage through expansion, they're able to kind of reprioritize. And because they know they have this safety, the safety of coverage, they're going to be able to do what their providers, their physicians are recommending for their healthcare. It's not that people don't know what is best for their health. For some individuals, it's just not obtainable. And I think this gets a lot of people closer to being able to obtain quality health.
Thank you, Dr. Pasha. Councilwoman Harper, we know that when Medicaid is expanded, it's going to make clinics more viable because they can get paid for their services. And if more clinics were able to open in Tulsa, what would that mean for your community that you represent?
It would mean life. With this expansion, that we will have the opportunity and certainly more interest in having urgent care facilities and more clinics so that more North Tulsans will just have that access to be able to thrive in their health and not just survive. I truly believe it is the difference between life and death, and life and just getting by with our day-to-day issues and trying to provide for our families and provide for ourselves. And at the end of the day, when we're talking about generational wealth, when we're talking about criminal justice, when we're talking about education, again, all those other social determinants of health, if you don't have a healthy life, then none of those things matter. And so I'm excited about the Medicaid expansion, and I'm excited about those economic opportunities so that doctors, in particular Black doctors, could flourish and serve their own communities. I think those opportunities will increase as well.
Dr. Pasha, just to broaden the conversation out a little bit more, can you speak to what you might see as the driving factors that determine the health of communities, and particularly Black and Brown communities in Tulsa, and kind of how you see access to healthcare or a lack thereof playing a role in that issue?
One thing we're realizing in healthcare now more than ever is that the health of a community doesn't begin and end at the bedside anymore. The days of that thought have kind of gone by the wayside, and we know that you can argue, and I strongly believe that social factors have an even greater impact on the health of a community. Access to care is tightly bound to social factors. We know that if you don't have good access, you're gonna suffer significant financial burden from healthcare contact. We know that socioeconomic status is tied very linearly to quality health. As someone's financial situation improves, so does their health. And that is consistent on every point on the graph. And so we know that someone's financial situation is going to get worse if they get stuck with a large healthcare bill. And that is going to contribute negatively to their health. We know that where someone lives, works, plays, and prays contributes to how good their health is, as we can see with the disparities across zip codes in our Tulsa. We know that education plays an enormous role in how healthy someone grows up to be. And so getting quality education, achieving a college degree plays a significant role. We know access to fresh foods and fruits and vegetables has a significant role. And so when we see Oasis come to North Tulsa, the new grocery store, that is a big deal. We know that some individuals who relied on public transportation were having to take a 4-hour round trip to get to the nearest grocery store to get healthy foods, right? But they can walk to the nearest Dollar General to get processed foods, right? And so all of those things come together and contribute to health. And you can see how different one community is in terms of these. Unfortunately, we will have to refer to them as commodities sometimes, how some communities have these commodities and other communities don't. And it shouldn't be like that.
Definitely. Thank you, Doctor. And let's talk about some next steps now that, Medicaid eligibility has been expanded in Oklahoma to cover more adults. What are some logical next steps that we can take to ensure that patients are receiving the care that they need?
Our priority as healthcare providers is to get the word out, to let our community know that for those of you who are uninsured, we need to check to see if you're eligible, because there's a large part of the population that doesn't really know how this works, and we've got to help guide them. We can't just assume that they can fill out the paperwork or that they don't have any questions. It's our responsibility to find ways to deliver them this healthcare. And one way to do that is to educate them and help them along the way. I think we also have to prioritize educating our communities about their health, arming them with the knowledge so then they can really take the reins and prioritize their health. Because now, if they have access, they're going to be able to prioritize their health a little bit better. And I think the other thing that I really call on healthcare to do anytime I get a platform is for healthcare to lose that paternalistic approach. We've got to approach communities' health with understanding and try to answer the questions, why are some communities' health not what it could be, as opposed to placing the blame on those communities and saying they don't prioritize their health. How can we help them prioritize their health? It's well recognized that Black patients have better outcomes when they have Black physicians. And this is even seen in newborn babies. There's a recent study that showed that Black newborn babies had better outcomes if they had a Black pediatrician. And this has nothing to do with, bad intentions of healthcare providers. It has a lot to do with systemic factors and implicit bias. But knowing that there's more access, there's going to be more funds into these communities, my hope is that it does bring more healthcare clinics with more physicians of color and healthcare providers of color, because we know that healthcare providers of color in general have better outcomes when taking care of patients of color.
And just piggyback on the earlier comments as far as what do we need to do to get the word out. And I think we historically have left getting the word out when it comes to medicine and healthcare. We've left that to the medical community. And I think that's a mistake. I think everyone really has a role to play in that, particularly when we're talking about elected officials and leaders, just leaders in the community, figuring out a way to partner and collaborate. I have a platform that physicians don't have, right? When we are communicating or engaging with a physician, it's because we've gone to the doctor, right? But what are we going to do with those people and for those people who never even think about entering a doctor's office or a clinic? And that's where we have to think outside the box. I am one that is known for knocking on doors. Just this past weekend, I literally got out in my community and knocked on doors for roughly 5 blocks around an area that's going to be developed. I knocked on those doors, gave out pamphlets, inviting citizens in those neighborhoods to attend a town hall meeting that's tonight to learn more information about this development. We can do the same thing when it comes to getting the word out about Medicaid expansion, getting the same thing out about healthcare, getting the word out about cancer screenings, whatever the case may be. I think that's what it's going to take for it to really have the impact that we know that it can, and that we know that's needed. And so I know I'm dedicated to that. I have, and so many others that sit in the same seats that I sit in, have access to citizens of all ages, of all economic places, and we can get that word out.
Thank you, Councilwoman Hall-Harper. Thank you, Dr. Pasha. Thank you, Lance, for your time and your perspective today. We appreciate you very much and have enjoyed this conversation greatly and hope to work with you again in the future. Thank you very much and have a good day.
Thank you to our panelists for that great discussion. And now I'm happy to welcome you all back along with Kristi Williams for our live question and answer session. So for our attendees, please remember that if you have a question for our panel, just submit it below using the Q&A button, and a member of our panel may answer. Please send more. We've gotten a lot of great questions, but we'd love to have some more for our panel. So let's go ahead and get started. Our first question: as a historian, can you talk about why it's so critical that we spend time with an event like the Tulsa Race Massacre when we're trying to understand current disparities?
I think it's always important to talk about history. It gives context to where we are today. And not only does it give context, but it also just really shows the growth. We have to see where we started, where we are, so we know where we're going. And so I think it's critical to anything we do that we talk about history.
Our next one is for Councilwoman Hall-Harper. We have some questions about North Tulsa versus South and Midtown Tulsa. Can you talk a little bit more about the difference in population and services in those two areas?
Yes, absolutely. My community, North Tulsa, and that would be Northeast and Northwest, the north side of Tulsa, has the majority population of African Americans. We have some of all, Native American, Latinx, Caucasian, but overwhelmingly the majority of Black people are in North Tulsa, and that's a result of redlining. You will find these types of communities all over the country because that was the policy, that was the practice. Put certain people on one side of town and certain people on another. So that's the reality of America and living in this country. And unfortunately, where those who are in better places economically, socially, politically, et cetera, where they live, that's where amenities go. That's where services are placed. And that, again, that's just the reality of, I think, any community, and certainly that exists in Tulsa. And so when we see that divestment that takes place, because again, the decision makers over the course of decades, right, when they are making decisions of where services, tax dollars are going to be placed, they make those decisions historically to be put in communities that are that the more affluent of society reside, and not those who are disenfranchised. And so that's unfortunately how and why we are where we are today when it comes to quality of life and just life expectancy in Tulsa.
Thank you, Councilwoman. This next question is for Dr. Pasha. It sounds like North Tulsa is a sort of a clinic desert too. What healthcare services are available to people in North Tulsa, and what is missing?
Yeah, it's there's definitely a dearth of clinics in North Tulsa. There are some. You know, we have Morton, we have Wayman Tisdale subspecialty clinic, which offers primary care, offers pediatrics, it offers some subspecialty care as well, like nephrology, neurology, and so there are some clinics. But when you have a community that traditionally has to rely on public transportation more than other communities, there's just not enough. There's not enough. And I want to be very clear that the answer to these health disparities is not solely access to care. It plays a major part, and access alone is not going to solve these problems, but it's a very important first step, because when you're sick, you need a doctor, right? And so there has to be a push to bring more services to this part of our community.
Thank you, Dr. Pasha. I think this next question that we've got in, it would be really valuable to get an answer from all three of you on this one. And that is, now that Oklahoma has expanded Medicaid, what do you think that means for your community and your patients? And Dr. Pasha, I'll go ahead and start with you.
Yeah, it's life-changing for a lot of people. You know, the people that before this passed were still living in poverty, but didn't have the option for Medicaid. And to think about what this can do from a financial perspective only is going to be life-changing for families, but also to start to be able to better prioritize healthcare. Because without health insurance, it is very difficult, as I mentioned, for people to prioritize their health. And it's not I don't mean that in the sense of casting blame. I mean that from a perspective of being understanding of the fact that it's really difficult to prioritize your health when you don't have healthcare insurance. And so this is going to be major. And as we talked about, we're talking a couple 100,000 people. And that's also going to really benefit the healthcare system as well from a cost perspective. And so there's a lot of really important reasons why Medicaid expansion is a good thing and going to be great for many people.
Thank you, Dr. Pasha. Councilwoman Hall-Harper, do you want to take that one next?
Sure. I certainly agree with the doctor, but I think it is life-changing. I think it will be life-changing, and it is the difference between thriving and surviving. Are you going to thrive in your life, in health, and that of your family? Or are you just going to survive? Are you just going to get by? And so again, I think it boils down to not just life, but quality of life.
Thank you, Councilwoman. And Christie, we would love to hear your thoughts on this one as well.
Sure, I think it's going to be critical. You know, when we just look at the data, we have about 80% of the Black population who lives in North Tulsa. And 35% of those are living in poverty. They are living in poverty. The equality indicators had stated that Black people in North Tulsa who are living in poverty actually experience 14 days or more of poor mental health. You know, when you just think about those realities, expansion to Medicaid is going to be critical for them, especially around mental health. And we hadn't even really touched on mental health so much, but that's a huge problem in our community because, you know, there's just, I don't know too many mental health facilities that are in North Tulsa, but if you don't have access to healthcare, you're not even going to know about those mental facilities. Just working at a school, I understand how parents are struggling because they're trying to worry about how they're going to pay the light bill. So they don't have time to really help their children study or really look more into their health. I was talking with our city councilor as we go to lunch all the time. And I hope she don't kill me for saying this, but we, in supporting Black businesses, I say we probably eat out most of the week and we're eating the wrong things. You know, in the past 2 to 3 years, I've gained almost 80 pounds, literally like almost 80 pounds in the past 2 or 3 years, just from doing the work that we're doing, because being activists and holding these positions that we hold, we're out here really on the streets from sun up to sundown. And Vanessa won't have meetings with people unless you go to Wanda J's and eat with her. So there's no place in North Tulsa to order salmon and a salad. You know, you got 3 choices: fried chicken, fried catfish, fried pork chops. And so, you know, I think with Medicaid expansion, also families could get nutrition services to really know about, you know, the importance of making wise decisions of the foods that we eat. And also, I think there's policies that can be created to where we can offer tax credits to these restaurants. If you serve healthy foods, you'll get a tax credit. There needs to be some type of incentive for that because I know it's more expensive for them to buy those foods, but we need to do that. And I think a lot of that can start with the Medicaid expansion.
Thanks, Christie. And Lance, before we move on to another question, I want to pass this one on to you for your thoughts as well.
Yeah, I mean, if we just kind of look at, you know, kind of historically or kind of what has happened since states have expanded Medicaid, I can talk from my home state of Louisiana when we expanded Medicaid in 2016. You know, Baton Rouge has a lot of parallels to Tulsa. You know, there's a north side of town that's predominantly African-American citizens that didn't have access to a freestanding emergency room, very little clinics. But since 2016, Care South, which is one of the larger FQHCs in the Baton Rouge metropolitan area, has not only been able to expand their clinic footprint, but they've also been able to expand the services that they provide to the citizens. So individuals don't necessarily have to take 2 or 3 buses to get to a clinic. They actually have something right there in their community. So I think we've seen this work in other places, and you know, we can definitely see it work in other communities like Tulsa as well.
Thanks, Lance. And while we've got you, we have another one for you. Have you seen any differences in coverage between traditional Medicaid and the Medicaid Expansion program, and how do those programs differ?
Sure. The traditional Medicaid program has, as I stated earlier in the panel discussion, been very focused to a certain groups of people. So those with breast and cervical cancer, those with disabilities, and the Medicaid expansion population. When states expand, these are mainly getting at the population of those individuals who are working, who are earning a living, but they're making, too much money to qualify for that traditional Medicaid program to have access to the health insurance, but they aren't making enough to cover and qualify the subsidies on the federal marketplace. And so they're kind of left in this area that we tend to refer to as the coverage gap. And so you have these individuals who want to do the right thing, who are, sometimes working 2 and 3 jobs to make ends meet. But if something comes up related to their health, they have to, literally sometimes wait until it gets so bad to where they can't go to work anymore before they go to the emergency room. And like Dr. Pasha shared his personal story, going to the emergency room is not something that's cheap, and using the emergency room as their primary care is not something that that is recommended. So, when folks have access to health insurance, they're able to really take care of themselves, get the preventive services that they need, get the screenings that they need to stay healthy, stay at work, and continue to provide for their families.
Thank you, Lance. And we have a really good question for Dr. Pasha here, I think. The pandemic has highlighted the huge health disparities that have existed for a long time, but that many people didn't know the severity of until we started seeing the numbers of COVID cases and the deaths between people of color and white people. I know we've already talked about the difference in life expectancy between zip codes in Tulsa, but what do those health disparities look like in other diseases as well?
Yeah, wonderful question. We know that there's not anything unique about COVID in the way that it's impacting certain communities. It's only provided us with a platform to talk about it. And I think that's one thing that I hope we can gain from this tragedy that we've been living in for the last year and several months, because we see these disparities in a lot of things. And we know in Oklahoma that our Black population is significantly more likely to suffer from stroke. We know that our Black population is significantly more likely to suffer from cancer and to die from cancer. We know that Black infants in Oklahoma are twice as likely to die than white infants. We see significant disparities in diabetes with our Native population, where they're 20, 30, 40% more likely to suffer from diabetes compared to whites. And so, again, this isn't anything unique to Tulsa. We see this in almost every similar sized city across the country. And it sheds light not only on poor access, but maybe more importantly, the social determinants of health that really decide if someone is gonna have access to health or poor health.
Well, I want to thank all of our amazing panelists today. Thank you to our audience for all those great questions. I appreciate you all taking the time to be with us today to discuss all these important topics. But unfortunately, that is all the time that we have. But the conversation does not stop here. I would like to thank Christie for giving us a virtual look into Tulsa and the Greenwood District. In addition, of course, to all our panelists who provided insights into how Medicaid expansion is one tool to help address disparities in Tulsa and beyond. Following today's event, you'll see a brief survey, and we've, of course, asked all of you to fill this out and share your thoughts about today's webinar and let us know what topics you would like us to cover as a part of our Medicaid and Health Equity series. A recording of today's event will be shared with each of you via email, and if you missed the previous event in the series, you can watch those recordings at medicaidcoversus.org/resources. As always, thanks for joining us and have a great day.